What black box warning? Or teach a doctor how to read. That's the title for this hour on the Robert Scott Bell Show. What if you were in dire need of medical surgical intervention and your doctor refused to help you? No, not because you didn't have money or Obamacare, but because you refused to take the drugs that actually caused the problem for which you now need surgical, for instance, intervention. And what if your doctor did not even know that the drug for you has a black box warning label? The worst of the worst. Oh, no, sorry, I didn't know that. Could this happen to you? Well, it happened to my dear friend Karri Stokely. And that's why we're going to have Liam Scheff and Dr. David Rasnick is joining me right now on this topic to update this outrageous medical behavior threatening the lives of everyone who lives or tries to live the non-drug life. Dr. David Rasnick, are you with me?
Yeah, it's a pleasure to be with you.
Well, I'm honored to have you back on board here. I'm so thankful that you're visiting with Karri Stokely to help her out in a really desperate situation. We haven't gone into the story here, but suffice it to say, at one point she tested positive to an HIV test, and from that point they put her on these antiretroviral and other drugs, and she woke up one day, realized this was killing her. She stopped them. She regained health like nobody thought was possible, but now she's had a lot of damage, and maybe you can explain to us why she was in the hospital, what was going on.
Okay, I'm going to give you a little bit of my perspective here for the folks who don't know me. I've been looking into this AIDS stuff as a scientist for three decades now, and I thought I'd seen everything you could see, all the insanity and everything, but no, that's not true. This past week was absolutely incredible. I want to make a point right before I start.
Go ahead.
We have to outlaw these HIV tests. We have to outlaw these tests. All of the evils, all of the horrors, all of the terrorism, all of this stuff that's going on right now is a direct consequence of these tests. They have to be outlawed. We outlaw those, most of this stuff clears up and goes away. This week, I saw with my own eyes what people who have been HIV positive, over the years. I've talked to them all the way back into the 90s up until now, and I've heard these stories from them, how they are treated at the hands of the mainstream health care people, the physicians primarily, and there are really horror stories. But it's one thing to hear it. It's something very, very different to actually experience it yourself and see it with your own eyes. And I think Karri will talk about that herself too. And from her 11 years on the antiretroviral drugs, even this came as a surprise to her what she went through this week. She's been off those antiretroviral drugs for about 3 years or thereabouts, and her body's been injured because of those things. We don't know all the consequences of that, and she's had other surgical ramifications over the years, which she'll probably go into details about.
David, suffice it to say that she was in the hospital. They had found thinning or an ulceration within the colon that was very dangerous.
It's actually, she has a rectal ulcer near the sphincter, about 2.5 centimeters by 2 centimeters. It's roughly, like an inch by 3/4 of an inch or something like that. And it's not healing properly. It's a classic non-healing wound, which is not that uncommon. And lots of people, I'm sure you're very aware about this, and
sure,
you deal with it yourself when people present that to you.
Yes.
And she went to the Orlando Hospital to have surgery done. There's surgical techniques that can repair these types of things, and they basically tried to blackmail her because she had this positive result on these HIV antibody tests all those years ago. Automatically, everything changes. These people are on autopilot. The surgeons primarily, and they would not treat her what she needed unless she started taking the antiretroviral drugs plus ganciclovir for the cytomegalovirus infection. And finally, it took a while to pull it out of the surgeon's mind, because he wouldn't answer. None of these people would answer Karri's specific questions, and it was like pulling teeth. But finally, I got it out of one surgeon what he meant by he could not operate on her until her immune system was improved. It had nothing really to do with the cytomegalovirus that they said they found from a biopsy in that ulcer. It had to do with she had to have the right viral load numbers, the RNA, HIV RNA count, and CD4 count. That was what it was.
All right.
In other words,
what did
you wouldn't
they say?
do anything without those numbers.
David, what did they say? We got about 30 seconds before the break. What did they say when she says, I don't want to take the drugs, there's no evidence that they will improve my immune system? What did they say?
Silence.
What about the issue of that they're black box warning drugs?
There was one of the infectious disease experts. She had two different opinions here, and one of them that came in and claimed he had 20 years experience in infectious disease, quote, HIV. He was a little bit stunned when Karri told him that it was a black box warning, had a black box warning label.
All right, stand by, Dr. David Rasnick.
Anemia, thrombocytopenia.
Dr. Rasnick, stand by. We got to take a break here. We're going to talk to Karri Stokely when we come back, get the backstory behind the backstory of things you will never hear. Could this happen to you? Here we have Karri Stokely's story, and Karri's joining me right now, and I want to get the backstory. Dr. Rasnick, David Rasnick, had referenced this experience in the hospital very currently in Orlando, the refusal to treat Karri to help her with her non-healing, let's call it an ulceration in the rectum. And now, Karri, this is something that didn't just pop up. You're talking years even prior to any knowledge of anything HIV you were dealing with in the medical profession.
Yes, that's correct, Robert. Thanks for having me on today, and I'm quite happy to explain the last 6 days of my journey through hell. But I think we need to go way back a number of years ago and kind of lay some groundwork for what has happened with me medically. When I was 18 years old, I had a breast reduction surgery. Within 24 to 48 hours or so, all the sutures came up to the surface and split open, and it was an infected, oozing mess for quite a while. They didn't know why. They just told me I had an allergy to sutures and maybe foreign body material reactions. Years go on. I have my first child in 1992, and I have her vaginally through a vaginal delivery. The gynecologist during the delivery cut the episiotomy to help with the delivery of the head. He cut it too far down into the rectum. I believe it's called a fourth-degree episiotomy.
Oh, yeah.
And I don't know if he didn't realize that, but nothing was ever taken care of with that.
And Karri, it's hard enough to heal from a tear, which is much easier than the cuts that they do, and much less when they cut too far, like you said, toward the rectum. This is a disaster for anybody. So healing from this could have taken months to years if it wasn't taken care of properly at the beginning.
It was months. They did various barbaric things to me, such as burning the entire perineum with silver nitrate to try and close the area up. Finally, 1 year after the delivery, a surgeon did go in and open everything back up down there, and he found a large rectovaginal fistula that he said resulted from the fact that the cut went into the rectum and it was never taken care of.
So this is a medically caused a physiological abnormality, and that could create all kinds of problems years down the road. So I imagine you were on many drugs, antibiotics, and other things for many years to address this.
Off and on, absolutely. With my second child, who was born in 1995, we did an elective C-section because of all the scar tissue and the trauma down to the vaginal area. Again, within about maybe 24 to 48 hours of having the C-section delivery, it was red, swollen, infected, high fever, and they said it was a staph infection that had gone systemic. They rushed me back down to the hospital, and I spent 1 month in the hospital on morphine and antibiotics and all kinds of other drugs. They cut the C-section back open and left it open until it healed from the inside out, and that took close to 3 months. After that, I never felt well again. I never felt like I bounced back as the months went on, and that's when I saw different doctors that were kind of checking me for different things. The one doctor I saw, who was a hematologist, suggested an HIV test. Again, this would have been 1995 right into 1996.
Karri, other than the medical things, the abuse, I would call it, that you had been under, was there any other lifestyle issues that would lead you to believe, hey, it's reasonable I should take an HIV test?
No, and I asked him at the time, why? Is that what you think it is? I was never in a risk category, any of the traditional risk categories.
Right.
I'd been married for a number of years. to my husband. I had no reason to think that would have been a positive test result.
Right.
But I let him do it anyway, not really knowing any better.
Well, and then the result came back how? What did it say?
Came back positive. He was very shocked. Matter of fact, when I asked him, do you think that's what it is, when they were drawing the blood, and he said, no, not at all. White middle-class women don't get AIDS. Came back positive. He was shocked. We were shocked. This is now June of 1996. And I said, my husband and I said, are you sure? Couldn't this be wrong? And his words to us were, excuse me, his words to us were, no, these tests are never wrong. We even did the backup test.
Hold on. I want to bring Liam Scheff into the discussion here. By the way, I have links to Karri, to Dr. Rasnick, as well as Liam at robertscottbell.com if you want to learn more about them in the short time we have together here. Liam, you with us? Karri, there you are, Liam. Now, you've heard the setup here and Karri's experience. Then suddenly they say, take a test. They say it's positive, and then where does it go from here? Liam, you've got this overview.
Yeah, it goes back to the 16th century when the people were using a book called The Witch's Hammer to determine who was really a witch and who wasn't. At this point, you're cooked. They totally abandon regular medical practice. They stop seeing you as a person. They see you as one of their millions of preordained dead. They, at this point, give you the most toxic drugs that have ever been manufactured for long-term use. These are cancer chemotherapy drugs. These are gene-altering drugs. These are bone marrow suppressing drugs. They kill the intestine, they kill the liver, they kill the gallbladder. This is no joke. The FDA has been forced to note this again and again and again by placing the black box label on them, which is what Karri asked when she was in the hospital. She said, can you tell me how this black box label drug that has done permanent organ damage and killed normal, healthy people at regular doses, can you tell me how this can help the local bacterial infection I have in an open wound that I have probably because my guts have been eradicated from 11 years of taking these drugs?
Yes.
The response was to say nothing to her, nothing.
I asked no less than 7 different doctors this past week to show me the evidence that these drugs will actually increase my immunity and help me heal. And they absolutely ignored my question. And I will say this about my gastrointestinal tract. I've been, since I stopped the drugs 3.5 years ago, I have been in a long process of trying to rebuild. I don't digest food well. There's no stomach acid. I'm not able to move my bowels. It has killed the peristalsis in the colon.
Right.
And I've sat and struggled with the bowel issues, which has created a very small anal fissure, according to a gastroenterologist.
And they basically refused to treat you unless you were on these death-inducing drugs, as Liam described them so aptly as well. And I want to relate this. We're going to go to a break momentarily, but I want to relate this because we're going to have Dr. Rasnick, we've got Liam Scheff, we've got Karri Stokely here to bring up something that you might think doesn't relate to you. But this is, what we say, a middle-class and white woman that said so they can't have this. Yet, because of this test that Dr. Rasnick rightly says we should ban, she has been nearly killed medically, pharmaceutically, iatrogenically, and now they won't even do surgical repair on her unless she's on the drugs that almost killed her. Could this happen to you? If you or your loved one goes into the hospital, this is the stuff you need to know.
Taking on bureaucrats and corporations that would stand in the way of health freedom. Here's Robert.
I will have some very pointed commentary on both Democrats and Republicans and Obamacare coming up later this hour, but we've got a lot more to do here with Karri Stokely, Liam Scheff, and Dr. David Rasnick. And Karri, I want to reiterate for all the people just tuning in, had been through the medical realm for many years, basically iatrogenic diseases caused by surgical interventions, through birth, through C-sections, through cuts during pregnancy. I mean, just horrific. Been on so many antibiotic drugs and wounds that had to recover, and then came up with an HIV positive response, so to speak, to the tests that we know on this show at least do not actually detect the presence or absence of a retrovirus, that they've never actually caught in the act of doing anything. But at this point, they began to give her the antiretroviral drugs, all of the things that were so toxic now that are black box warning labeled type drugs. and basically can wipe out a healthy person, and damaged and wiped out her gut as such. Now we're dealing with basically an area of the rectum, the colon, if you will, that's thinned out. It's like an ulceration. And she's in the hospital in Orlando. The docs actually did exploratory. What did they find, Karri, and what did they do next?
Well, it was about 6 weeks ago when I presented with higher fevers and increased rectal pain that would not go away. I went up to see a colorectal surgeon who took me immediately to surgery that day, and he described and took pictures of this big ulcer that he'd found in there. He said he debrided it, cleaned it out, and he would have to go back in probably 2 or 3 more times and lay some skin grafting. Well, 3 or 4 weeks goes by, and I'm really not getting any better, so I go back in to see him. He says to me, you need to be admitted into the hospital on IV antibiotics. We'll have to try and get the wound under control. They'd also biopsied it when he was in there the first time, looking for cancer and other things, which all came back negative, but he did say there was CMV biopsied. They have been searching for that the last 6 days while I was in the hospital, and they don't seem to be able to find anywhere else. But the bottom line was, unless I, according to them, and they're basing this on T-cell CD4 counts, unless I can get my immunity boosted, they refuse to do surgery. The problem with that is when I asked repeatedly how these drugs would boost my immunity, they had no answers for me.
Yeah,
they've been using techniques such as you're on your last legs, you're in the end stages of life, you will never see your daughter get married. These are the things that they've been telling me instead of answering my question.
It's a criminal. I'm not kidding you. And playing the Anthony Fauci clip of the Smooth Criminal is an understatement. Liam, your perspective on this? I mean, it's just horrific. It breaks my heart hearing these stories.
Right. Let me pull myself together. I don't. If you read the medieval text and you read about the witch's hammer, it was a book that was used in the Inquisition to beat women into admitting that they were witches. And they would take their daughters and beat and torture their daughters, and then finally the women say, okay, I'm a witch, and then they would kill them. The human species hasn't evolved or really changed very much. These people take this blunt hammer of a diagnosis. Karri has been so brave. Today, she did what no human being should be expected to do. She came on a nationally syndicated radio show and gave the deeply personal details of her medical history, of the way that she has been assaulted and butchered by hack doctors, over-medicated, over-drugged, that she willingly went along with as a good patient as long as she could stand it before it almost killed her. She turns to these people, and we have to talk about the bad guys, because the bad guys, this is what they live for. Nobody understands this because everybody avoids the AIDS business. But the guys in the AIDS business, like Seth Kalikman of the University of Connecticut and John P. Moore of the Weill Cornell Medical Center, publish blogs and papers decrying people like Karri for trying to get better without taking their black box labeled drugs. Karri took them for 11 years. They wore her down. She's got age progression pictures, and you can see the effects they have on her. These people do not rest until they get another death in their hands, and they will be on the internet today, having listened to this, howling for her death.
Liam, stand by. We're going to go into the psychology of this, as well as the fact that if someone takes chemotherapy, we might not agree with it, but we're rooting for them. Why do they not root for Karri? We're going to find out as well on the Robert Scott Bell Radio Show. More with Liam, Karri, and Dr. Oh boy, we got lots to do. Stand by. We're coming right back. Right now we've got Karri Stokely on, Dr. David Rasnick, and Liam Scheff. I have links to all of their sites at robertscottbell.com in the show description for today. And, Karri, through all of this, you're still willing to go through the medical intervention if it's necessary. It's not like you've rejected modern medicine outright, but yet again, in this, let's say, interaction within that realm, what they've done to you is just horrendous.
It is, Robert. And when you take a young, healthy wife and mother, healthy to an extent before the surgeries, and diagnose me on a fraudulent test, and then insist that I take this type of toxic black box medication for 11 years. There's no way to think that I'm not going to end up with a lot of damage. I should have a lot more damage than what I do. But I know what these drugs have definitely done to me personally has destroyed my gastrointestinal system, which is where 80% of your immunity lies anyway. It's been a constant struggle for that. But the problem at the moment, really, as much as they would probably like to see me sick and dying, that's not really happening. But the bottom line is there is an infection due to this drug damage that has destroyed my colon, and I do need help to get that fixed.
Yes, and seeing that they are, wanting to force you on toxic medicines that may not, well, certainly will not improve immunity, much less the red herring that is the HIV test and the HIV. We're looking at something like, many of the children I've covered stories on that had cancers of some kind, and their parents investigated, and they investigated and decided to go holistic, and then they want to steal the children to force them to undergo chemotherapy. This is going to happen more and more unless people like Karri are speaking out here to raise a warning flag. I mean, it's as Liam said, it's brave enough that you're on here in the midst of all that you're going through, but this should help many millions of people wake up and realize that they cannot trust government and government-sanctioned medicine as the only way. We've got to look at opening this up wide for all healing. And Liam, we talked about before going to the break, we may not be in favor of oncology and chemotherapy, but if someone's going through it, I'm rooting for them. I want them well. What is it on that side of the equation? Look at a Karri Stokely and say, you've gone holistic. We hope you die. I mean, that's basically what they're saying.
They say it openly. They say it outrightly on their blog. Seth Kalikman, University of Connecticut, says it all the time. He hopes these people are going to die. He's so sorry, but they haven't accepted the magic pill yet. Well, she accepted it for 11 years, and it nearly killed her. For the AIDS industry, I'm afraid to say that every death is a victory. They have claimed absolute governance over an area so wide, so varied of immune dysfunction, from drug addicts to the most poor, wretched of the poor people in the world, and they've decided that all of them are sick because magically 20 years ago they had sex and now they're sick. It's absurd. It's absurd beyond satire. They have three competing theories that are mutually contradictory about how any of this can happen, and all of those have failed proof anyway. They don't make room for other people to get better, because the second that they admit that an AIDS patient can get better, they stop printing money and they stop the eugenic program or whatever they're doing in Africa by labeling all the poor people as having some sort of sex disease. And then the New York Times has to stop printing wonderful editorials about how we should circumcise all black people and drug their women to death. And this is a giant, giant political mess. It's a giant political scam. It's absolutely disgraceful. And the doctors who treated Karri failed. Dr. Samuel DeJesus of the Orlando Colorectal Center and Dr. Paul Williamson of the Orlando Colorectal Center, who looked at her and refused to answer her questions about what the drugs would do and talked over her, failed even the basic Hippocratic oath that they took so many years ago. First, do no harm, and try to help.
What about fully informed consent, for goodness sake?
Yes, the idea of informed consent, fought for so hard by people who were murdered by the Nazi regime. The idea that came out of the Nuremberg trials, that people have a right to know the medical experiments that they're undergoing, are constantly and consciously refused to AIDS patients all the time. They're bullied and intimidated.
Well, and not only that, but they will threaten you if you refuse these drugs with a diagnosis of dementia.
And they'll take away your children, and they'll drug your children. The amazing thing is Karri's got 2 healthy children, all HIV negative, and a healthy husband, all HIV negative. Go figure. These tests don't mean anything. They mean that she had an illness before that caused the test to come up positive, and the tests come up positive for what? Pregnancy, bacterial infection, drug abuse, because the proteins are all nonspecific, and everybody knows it. Everybody knows it.
Including medical drug abuse, for which they inflicted upon Karri Stokely. Karri, my love to you and your family. Liam, as well to you and Dr. David Rasnick for standing with Karri and making a difference here, and for all the people that are believing the medical lies that because you test positive on a nonspecific cross-reactive antibody test and get confirmation from other tests that can't confirm it, that you're going to die. No, you're not. You're going to live, because you're listening